Everyone, Amy Wood with WSPA TV 7 News as we continue to look into the Whitten Center investigation, the outbreak at the Whitten Center that 7 News has been paying attention to over the last couple of weeks now, mainly because you guys brought it to our attention. We were doing something on nursing homes on Facebook Live, and we heard from the audience that there might be something going on at Whitten Center with COVID-19. We started asking questions. It was not listed on the DHEC list of nursing homes, assisted living, and now the intermediate care facilities, which is what Whitten Center is. And we have reported to you tonight with our investigation that you can find on WSPA.com that a multitude of staff members have come forward to 7 News, to me, reaching out, talking about their concern about how things have operated during COVID-19. They're very fearful of being fired. They talk about that a lot. There's a sort of a fear, but we want to talk a little bit about what the center has provided to us, because we had a limited opportunity on TV to talk about that. I want to show you, this morning I got this email. We've been asking the director for an interview, and we were trying to do that via webcam. That's the safe kind of way to do things. I'm high risk for COVID. I don't want to get it. And I've been doing all my interviews via webcam, and we could not get anything worked out. She wanted to do it either in her home or in her office. And so we're kind of at a standstill with that. We hope maybe she will consider the webcam option. I've talked to the lieutenant governor, the senators, a number of people in state leadership and national leadership that have been willing to do webcam interviews. So we hope that they will reconsider. But in the meantime, we do have this 2-page document, and I want to pull it up on screen. You're going to be able to still hear me, I hope, as we do this, but I'll pull myself into the screen here just to make sure. We're going to take a look at this. This is the document, and they're talking about the recovery, which is really important to talk about, right? We talk in COVID. A lot of you ask us all the time, tell us about the people who've recovered. And at Whitten Center, they're saying, according to this document that you can find fully posted on our website, WSPA.com, that a lot of folks have recovered. They're saying about 26% of the folks are still sick between staff and residents. They have 151 total cases between the staff and the residents. 57 of those are residents, 94 staff, and now they're saying most of those folks have recovered. They're saying now there are 18 residents still sick and 22 staff still sick. So that's encouraging for the center's operations, right? That they can maybe get some semblance of this behind them. But we also want to talk about what else they're saying. They're kind of rolling through on this as I roll up the screen. This is a comparison of Whitten positive cases with prior day results. So you can kind of see things, how they increased, which is important to understand. They're also talking about where it was in the various buildings. And this is at the beginning of COVID. They're discussing like which buildings had it, which didn't. They're saying some of the reasons that not everyone had PPE was because some people didn't need it. They're talking about sort of the way it exploded on their campus in terms of where it started and where it went. Interesting to look at. You're welcome to check this out again on the website. I will say one of the interesting things is Amanda, who was in our story, Amanda Weathers. She was the nurse who refused to go into what she said was a non-COVID exposed unit. This document confirms if she's telling us the truth, that this unit that she was going to be going into had no COVID cases at the time that she was being asked to go into it, and she had been exposed to 3 people. So that's interesting as well. We also want to draw your attention to the sentence that's way down lower. I'm going to try to zoom out a little bit, but there's a sentence there that reads, do I have it up? Let's see. The notion. So in that paragraph that says the notion, I'm going to pull it full. You can see that they're saying the reuse of PPE that has been exhausted in its useful life did not occur. So that's a pretty blatant denial by the center that anybody was using PPE beyond its safe or useful, I will say useful use. It's useful use. That's what they say. So that is an important denial and something we definitely want to let you know about. That's their take on this. I also want to draw your attention to the final paragraph here as I go down. This is comparing, by the way, this graphic here is comparing their outbreak to their PD regional outbreak. Oh, my thing is not going up and down any longer. Let's see. Let's go back to me. It's not going up and down, but I'll tell you about it. Down here they've got on the graphic, and you'll see this on the website, a comparison to Myrtle Beach area, or Florence area, I should say. Their facility, the PD facility, had an outbreak in April. So it compares the two. So you can look at the numbers if you'd like to compare those. Also, he does say, this is from Pat Molly, and he says he's a deputy director with the Department of Disabilities and Special Needs. And he says, I have had the privilege in my career to witness many acts of bravery and heroism from those in the arena, while the rest of us sleep soundly in our beds. He says Whitten staff's efforts during the surge in COVID-19 cases ranks near the tippy top of that. And just to be clear, 7 News has not in any way meant to in any way slight the efforts of the staff that has been there doing their very best. And I don't think the staff is in any way saying that to us. They are not saying that they feel slighted. They know they're doing good work. The question is, they feel, according to the comments that they've made to us and the information they've provided to 7 News, it seems that they feel that not enough has been done to protect them. So therein lies the report. You can check it out on WSPA.com and see what they have been saying about that. But we've got a lot on the way in this extended investigation tonight. Okay, so I'm going to be bringing you a couple of things. There are going to be some interviews that come, one of which is going to be with a doctor who is an infectious disease expert. And we're going to talk about that in a few minutes. We also have the sister of Maurice Maurice Simmons, who passed away. Maurice Simmons was the man who was the healthcare worker at the facility. And he sadly was the first casualty in all of this. The sister did an interview with me. We're going to talk to Ella in just a few minutes. You're going to hear that. And then we also have a mom whose son had COVID. She is part of the Parents Club. She believes in the administration. She believes in the place. And she's talking just about what that experience was like for her as a mom watching COVID unfold on this campus. And she's very grateful, obviously, that her son is doing well and okay. So we're going to talk with Mary Mills. But I also want to tell you a little bit, we mentioned this on the news. There has been an allegation involving the DHEC stuff, right? There are a bunch of reports from DHEC. These are Freedom of Information reports DHEC provided to us. We had asked them to give us anything that had been going on. And so this is all stuff during the pandemic. These were all filed on June 30th, which was the day of that inspection. And there are a couple of allegations here that I want to go over. So one of those is something that happened on March 6th. This was in the day room, unit number 106. And they were cited for the facility not reporting abuse in a timely fashion no later than 2 hours after the staff sees it. And this was involving holding back an arm, holding a nose closed, and yelling at someone. They say one of the people involved's abuse training was not up to date when they investigated, and they're saying that they fired 2 people as a result of what happened. Then April 20th, there's something about a resident being hit by a chair by a staff member who reported the injury as a fall. This was on 4/20. The resident was hit with the chair on a patio. According to the report, resident was bleeding. A witness did not tell nurses before leaving work. So there was a small puncture wound to the left eye, I understand. There was 1 employee fired, 1 employee warned to make sure that you never see something like that and don't tell a nurse about it. She did, or he did, do the right thing and reported it to SLED, which is what co-workers are supposed to do. If they see something wrong in the facility, they're definitely supposed to let SLED know about it. That's required by law for them to report it. Also on May 25th, campus improper restraint situation that led to a resident and staff members falling to the ground, and they cited that there was no annual restraint training documentation for them to review in that situation. And then June, this was something they found was not cited. So this is interesting, like some of the things they investigated and didn't find. One of the ones was an employee being positive, instructed to report for work. They looked into that, and they said there was nothing to that. So there's a lot more on our website regarding all the story, the entire background of what we reported tonight, and we want you to go there and look into it. But 2 of the main pieces of conversation and debate are the reuse of PPE. That's kind of some of the core of what the staff has questioned and what some of the experts we've talked to have questioned. And so what I want to do here is I want to roll this interview I did with a doctor. He is a guy who's working in the ICU with COVID patients out in California. He has an infectious disease specialty. He's super familiar, obviously, with using PPE. And so he's going to walk us through his take on this. So I want you to take a listen and watch this interview. This is Alejandro Villegas, and he is out on the West Coast. So listen to his interview. Hey everybody, Amy Wood joined by Alejandro Villegas. He is in California. He is a critical care and infectious disease specialist. And I pulled him into this conversation about what's been going on at the Whitten Center because I want some expert advice here to get some feel for what is happening, what the workers are saying is happening, and what should be or should not be done. So we're going to start, Doctor, with the first issue, which is the whole situation with N95 masks. There's a shortage around the country, although the officials at this place say they don't have a shortage, but there is a shortage around the country, and people are re-wearing them. But the question is, how long do people re-wear them? We have staff members telling us that they are re-wearing them. Some people say they've had their masks since June 25th-ish, and they're still wearing it. And they keep putting it in a bag each day and getting it back out the next day. Does that sound right, if that's indeed happening?
Good question. It's not what we're used to. N95 mask is not meant to be worn on a daily basis. We've never had to do that ever until this pandemic. Mm-hmm. Now, and of course, it goes through its wear and tear throughout the day. I reuse my N95, but what we have to make sure is if it's having an appropriate seal around the nose area, the mouth, that we're not bending it in half, that it retains its shape, the contour of the mask throughout the time that we're using it. Now, weeks is probably too long. I've used an N95 probably up for 5 days, but I'm making sure every time that I'm putting it on that it has an appropriate seal around my face, the bridge of my nose, and that the elastic portions that wrap around the head are tight enough to maintain that seal. That way, no aerosolized virus particles can enter throughout the sides. Now, most people aren't aware of that. Unfortunately, we are having shortages in N95s across the nation. And a particular point in time when a mask has to go in the trash, it's hard for me to say. But if it's soiled by any kind of, saliva, if it gets wet, if any of those contours of the masks are not maintaining, it should not be reused because that decreases its ability to protect you.
And talk about the fit, right? Because the fit matters. And so you were saying, Absolutely. I heard you when we were talking earlier that, you guys get fitted for the mask. Like I guess they have different sizes and they try to make sure it fits
Yes.
correctly.
So there's different sizes they come in. People have smaller faces. Some may have regular, what they call, or a different size. So every time we have a new, say, manufacturer of a mask, we get fitted for that particular manufacturer for that particular mask. We basically put it on, and then there's a hood that goes over us, and there's an aerosolized substance that's sprayed within that hood, and we're asked to have different motions with our face, inhale, do certain things that we normally do when we're working, and then they're testing to see if we can smell or taste the particles that they're spraying within this hood. Wow. So somebody who wears a small mask shouldn't go grab a regular size mask because it's not going to fit appropriately. And just the opposite goes the other way. We want to make sure that obviously that seal and the portion that's protecting where we're breathing is appropriate for our face.
And the risk, of course, is infection if you don't have it sealed
Yes. Absolutely. The particles, and depending on, if we're talking about coronavirus, I mean, you'll have, believe it or not, the experts in all of the world, they're still debating to what degree is this virus transmitted by droplet particles or droplet nuclei or aerosolized particles that can float around in the air longer than what say a droplet would go 3 to 6 feet, the whole 6 foot rule. where a larger particle will not go that far. It'll fall to the floor. You won't inhale it from that distance. Whereas smaller particles that are aerosolized can float around in the air, last longer, and we can inhale them. That's where the N95 is important.
Yeah, that's good information, especially for our healthcare workers in the area who may or may not know all of this or be having this done. They may not be getting that level of fitting like you're talking about that you're getting at your hospital out there on the West Coast. Talk a little bit about the donning and doffing of the plastic disposable gown that you put on over the top of a regular gown. That you're wearing into the COVID patient's room, like that extra layer of protection. My understanding from what the staff is telling me at this particular facility, Whitten Center, is that they have sort of one of these little stations. It's made of like PVC pipe and got some plastic around it, and they have some hangers in there that they hang their plastic, basically raincoats, that they're wearing into the room on them. And there, I had one in particular who I asked specifically, like, how many people are sharing this? Because apparently they are sharing these disposable gowns for 3 shifts, and then they're thrown away at the end of the day, or at least up until recently they have been. Does that sound right? Is that a good practice? They have an outbreak in the staff of infection, 88 staff members that are infected.
Yeah, I don't listen. We rarely ever use reusable gowns when we're talking about protecting ourselves and protecting staff members and protecting other patients in regards to infection control, especially for something as easily transmitted as the coronavirus. Now, I don't know, I don't know what they have there. Most cases, what we try to do is use disposable gowns. If we have the ability to have reusable gowns, or if it goes to that, which we're doing now, believe it or not, in big hospitals in California, we're switching to reusable gowns. But it has to, the whole donning and doffing, what we call putting a gown on, putting our protective gear on, is less risk, or at least it should be, than something when we're doffing or bringing it off. When you can imagine when we're putting on clean or brand new PPE or our protective equipment, we're going into the room, it hasn't touched anything. We go in, and when we're coming out, we have to pay particular attention on how we doff or take things off, because essentially everything that we went into the room with now potentially has that infectious organism. And we have to take it off in a way that's reducing the risk of us getting infected and the people around us. There may be in what we call an ante-room, where we keep, where we doff these things, where we take off our gowns, where we more than likely either put them in a trash bin, or if it's a reusable gown, we put it in a bin that's eventually going to go get decontaminated. Rarely do we ever have the case where we're reusing a gown from one person to the next over the course of shifts or the entire day. That just leads itself to more error in the doffing procedures, the donning, especially if we're reusing a protective equipment. We want to make sure to wipe it down completely. If it's going to be reused, believe it or not, like some of our hoods, what we call PAPRs, these powered air purifying positive pressure masks, and everything has to be very well decontaminated before somebody else uses it, even when you're going from one room to the next. So, yes.
When you said, when you're getting your stuff on, it's all fresh and clean, and you don't have as much risk. But if you are putting on the rain poncho that somebody else has used, it's a different experience, I would suppose.
Yeah, I mean, definitely if you're reusing any kind of protective equipment, it has to be decontaminated. For example, the respirators that I mentioned earlier, we reuse them, but everything has to be decontaminated very well with certified chemicals that have the ability to take care of the coronavirus and other infectious agents. Um, so which manner they're using and reusing is a very important question, because the person that is going to be putting on that gown again, are they sure, it was completely decontaminated appropriately? I mean, those are, important questions to ask for sure. But especially if you're reusing any kind of protective equipment, definitely has to be decontaminated with an appropriate chemical agent.
The staffers are telling me that they have a spray bottle of rubbing alcohol and they are supposed to like kind of spray it down. Does that sound sufficient?
Probably not. Listen, generally we don't just spray rubbing alcohol on reused equipment. There's different chemicals. We use Oxivir here, and there are little towelettes that we use. Believe it or not, I mean, the chemical that we're having to use the Oxivir, we're having to reuse certain bins and put the chemical inside and soak the cloths that we take, and then we decontaminate everything. So, um, you know, uh, to comment exactly on what chemical they're using, I'm not confident that that would be enough. Again, it all depends on the fashion that they're doing that, as well as, is the person putting on and off the protective equipment, are they responsible for doing that? Do they have somebody else? Um, you know, a lot of these measures take time, and, you know, attention to all these little details, because if they're not followed, you're putting yourself at risk, you're putting others at risk, you're putting your patients at risk. So there's a lot of these little details. Listen, this is new for a lot of people. Large facilities aren't used to taking care of these infection control matters. Um, you know, Usually big facilities have their own infection preventionists, or people that monitor and maintain infection control practices. But it's these little measures are what make the difference, especially in pandemics and outbreaks in closed facilities.
So I have an important question based on the couple of things that the staff has told us about sort of some of the practices. Does it surprise you in any way that 88 staff members so far, the number may be climbing, I don't know what the latest numbers are, but as of last week, 88 people on the staff have become infected with the coronavirus?
I wish I wasn't surprised. You know, the only reason I'm not is because I know of several places that this is going on. Um, this is something completely new for a lot of people. At this point, I would have really hoped that this wasn't happening, because we've learned a lot about
Yeah.
this virus.
Hmm.
Our, you know, Depending on where the guidance is coming from, obviously
Hmm.
that's important as well.
Right.
I really, really hope that at this point in the stage of the pandemic, that this would not be happening, but it's not. It's not an isolated issue. Um, a lot of it comes with direction, meaning that there has to be leadership directing all these little details. Um, and things have fallen through the cracks in a lot of places, unfortunately. I'm not surprised, but it's sad that this is going on.
Yeah, it is. And they've lost a staff member, sir, which is heartbreaking, along with two, possibly three of their they call them consumers, but they're residents. So it's a really sad situation, and we're just trying to like sort of help raise the understanding. Amy Wood back again. We were having broadcast interrupted as the doctor's interview was wrapping up, so hopefully you got to hear all of the doctor interview. I'll post some of these nuggets on our station page later this evening so that you'll be able to see them in full. But I do want to bring up just a really quick look at what's happening on our website right now. Before I go to Ella, the sister of Maurice, who passed away, we want to tell you a little bit about something special on our website. We've got a special feature that you may not know about. I'm going to add it in here really quickly. It is basically a live look at how the story unfolded when it comes to COVID-19. So, you know, we've seen a lot go on with the COVID situation and how it unfolded at Whitten Center. And this investigation is continuing right now on our website with WSPA.com, giving you the full details, including the response from the officials at the facility. This is the Whitten Center in Clinton, serving intellectually disabled and special needs adults. And one of the things we have up is this timeline. I want to show it to you really quickly. So there is a timeline available that you can check out. It is interactive, so you can zoom in on it. You can scroll up and down and see different things that have happened over time. And it really is neat. There's also this play button on the left-hand side of the screen there. I don't know if you can see it. Let me pull it up full. That play button there on the left side of the screen, see where my cursor is? If you hit it, it'll start walking you through events as they unfolded. So you can kind of go through a timeline of what's happened in relation to CDC developments, governor's announcements, Channel 7 coverage, whatever else has been going on. So check that out. That is on our website, WSPA.com, in the story that we posted. I also want you to understand that we don't have the personal stories of the residents who passed away. We don't know those names. We have no way to tell those stories, and we indeed, of course, would love to pay tribute to those very special people who have been lost in this COVID outbreak. We also do know the name of the healthcare worker, the sole healthcare worker who has passed away as a result of what happened. And I want to show you, this is Maurice. He was 41 years old. He had just moved to the upstate at the beginning of the pandemic, and he actually switched into healthcare. He'd been in the coaching world, loved working with young people. And so I talked to his sister. Her name is Ella, and she took time this week to speak with me despite the grief they're going through. So here's Ella's interview. Hey everyone, Amy Wood. I'm being joined by Ella Simmons Jordan. She is Maurice Simmons' sister. She and Maurice grew up together. Her aunt actually raised them, Maurice's mom, right?
Our grandmother and my aunt raised
yes.
us. Uh-huh.
And so y'all have been close your whole lives.
Correct.
And I know this has been really, really hard on you. Talk a little bit about who Maurice was, because when you look at his pictures, he seems like such a fun and gregarious person, and somebody I'm sure you miss terribly.
Yes, we do. He was always family oriented. He loved youth. He spent majority of his adulthood working with youth, with coaching. So he just loved mentoring and reaching out with the youth to help them grow and be better. He was the type that, you know, if his nieces and nephews had cell phones and ways that he would stay in contact with them. He's, you know, was just always reaching out, had a big heart, fun, loving, and just enjoyed family.
I've seen the local papers there, Ella, that have done these sweet stories about him and his connection to the community, and especially Coach Mo. They talked about Coach Mo.
Yes. Mm-hmm.
And then how did he get into the healthcare world? Where did that switch come?
He actually moved from Watersburg, South Carolina to Clinton, South Carolina. And I'm assuming that he wasn't able to find a job in the coaching, so he took the job in the mental health field, which isn't far off from. We have a uncle that has developmental disabilities, mm-hmm. So you know our family is familiar with that area, and he, you know, is able to connect And it's just, with individuals have developmental disabilities, they also are, more like the youth. So that fit right into him, with him.
Yeah, absolutely. I had a number. I've talked to a lot of the staff there, and they
Hmm.
did. Those who did know him say he was stepping up a lot. He was stepping up to help out other coworkers, to take a shift for them. He always seemed to be working a double. He's always kind of really
Yeah.
busy and working.
Yeah. A lot of times when I talked to him, he would be pulling doubles or working. I thought they were just short staffed, but I didn't realize he was covering other people's shifts. But with he was working a lot. So when you would reach out to him, he was always at work.
Oh, he's at work.
And hmm
Talk a little bit about what's happened. I mean, how did this play out for you and your family?
um, I got a text from Maurice on Tuesday. I want to say that was the 23rd, that telling me that he tested positive for COVID-19. I immediately picked up the phone to call him because I knew he was living alone, and I just wanted to kind of assess to see how he sound. And he was short-winded, and he said that he only, if he moved a lot, he wasn't, he would get short-winded, but he was short-winded when he was talking to me. So I asked him, kind of let's walk through a scenario in case something was to happen. How would he be able to get help? And I asked him if he had a neighbor that could check on him or at least call, and if he didn't answer, to know that he may need help. He ended up driving himself to the hospital on that Wednesday morning, and I got a call, and he, told me that he was checking in, and he listed my information for them to contact me. So, where I talked to him on and off Wednesday, um, Thursday, I talked to him on and off. Got a call Thursday evening from the nurse, where he wanted us to know what type of treatment they were planning to start, which was the plasma and some type of antiviral medicine.
Mm-hmm.
Um, and so I asked her, so does he want me to know this to research it to see if it's safe? Or she says, no, he just wants the family to be aware and for you to let his mom know and explain it to her. So once I hung up with the nurse, I called his mom and discussed that with him. And I called him to make sure that I was understanding what he wanted. Um, didn't I texted him on Friday morning, didn't talk to him. Um, by Friday afternoon, after he hadn't replied to any of my texts, I started calling around to other family members to see if anyone had spoke to him. And my aunt had spoke to him that morning, and she said they had about a 30 or 45-minute conversation, and he was upbeat and laughing, and like he was feeling a whole lot better. And he said he felt better. And so I couldn't. I tried calling through the hospital because I still wasn't able to reach him, and he wasn't responding to texts or answering calls. And I called the hospital, but I could never get through to speak to anyone. And so I took a shower, and we got dressed, and we live about 3.5 hours away from Clinton, South Carolina. And about 9:30, I got a call from the doctor saying that he had that my brother had had a cardiac arrest, had went into cardiac arrest, and that we needed to get to the hospital. So I explained to him that we was 3.5 hours away, and that we were on the way. So I called and notified our brother, Christopher, and him and his wife left, and my husband and I left, and we drove and arrived to Clinton, South Carolina, to the hospital at 1:30 that night. And at that time, we were taken back and told that he didn't make it. And I'm not sure why they had us to drive all the way there because we weren't. I thought maybe we had to sign paperwork, but we didn't. So
So you climb back in your car.
So we climbed back in our cars and drove all the way back home, arriving home a little bit after 6 that morning.
Mm. How bad did this hurt you?
Terrible because Maurice was, um, excuse, He was, I can remember Aunt Betty bringing him home from the hospital, and I asked her, could I have him? And she said yes. So he was my doll, my live doll baby.
Mm.
So my thing was, I spent my days rocking him to sleep, feeding him. And, we're only 4 years apart, but so we always grew up with him being close. We were always close and communicated a lot. So it's hard, but
I'm so sorry for your loss. I really, really am. Uh, have you talked to anyone at the Whitten Center about what happened, the conditions he was working in, anything?
no, we have received articles from uh, from different people that have reached out from our Facebook posts when we posted and would tag Maurice so his page would also have the same information. So they would, people were sending us information, and we had received a letter that I'm assuming one of his coworkers had written that stated the condition that they were working in, and I think they were sending that to um, someone higher up so that they could look into the situation. And I don't remember it having a date on it, but I
Mm-hmm.
do remember talking to Maurice because I have asthma and my daughter have asthma, so I was following COVID since it was coming out of China, so I was concerned and had started preparing and getting stuff together. And I was talking to him, and his where he was working at didn't seem to change. Nothing changed. They had nothing in planned, and that surprised me because it was a state agency, and you would assume that they would have guidelines and stuff they should be following.
What kind of things didn't change in terms of what you would have expected or that maybe he mentioned?
They weren't required to wear masks. From my understanding, it was no different in the cleaning schedule. I mean, they were operating as normal, just like before COVID, hit.
I think they rolled out some procedures, and we don't
Mhm.
have those officially from them. We only know what the
Mhm.
staff has told us about. They
Mhm.
did eventually embrace masks. They did eventually
Mhm.
add other things that other places do, the N95 masks and other things. But we've spoken to an infectious disease expert who said it was kind of more the way they were doing things that might be the issue, according to that expert, that the mask wearing might have been not fitting right, perhaps. They're reusing their masks
Mhm.
perhaps too long. I don't know that they had those masks when Maurice was sick. They may have been rolled out right
Well, I
around that
didn't.
time.
Yeah, I don't remember him starting to wear a mask until the end of May,
Hmm.
being required to have a mask on at the end of May. And what the states, where I live in North Carolina, so we shut down the middle of March.
Hmm.
So that's a long time frame.
Yes, ma'am.
And then from reading the articles, I don't know if it was Florence, South Carolina, anywhere where the other Whitten Center had already experienced the outbreak. So that should have, prior to this happening. So
Hmm.
you would think that it would have been something that they would have been on and handled if, one of your centers has already
Gone through that.
went through that.
Talk a
So
little bit about this fact that have you been contacted in a way that you might expect an employer to contact you after the passing of your loved one? Has there been any outreach to the family?
no, we have not talked directly to the director at all. Um, Not at all. I mean, I only call I've received from anyone in Clinton, South Carolina was the um, coroner called me that Sunday following his death on the 26th, which was that Friday.
And so you haven't heard anything. I will show you something. The director has sent a letter to the family. to the families of the patients or the residents there, and this expresses condolences to you guys as well as others that have been lost. But it says, we express condolences to the folks, our staff member who passed away, to the family of our staff member. What are your thoughts on that? Because that is posted on the Whitten Center Facebook page, and as far as I would know, that would be nothing you would ever see unless I told you about it.
Correct. I I just it's just bizarre to me, the behavior that you have someone working for you and you can't reach out to the family. I mean, I haven't received the letter. My aunt hasn't received a letter, or his brother Christopher or Jonathan hasn't received a letter. And I mean, if they sent it to Maurice's apartment, then maybe it's in the mailbox there. But we're not local, so we wouldn't be able to access it, and we definitely don't wouldn't know it was on their page. But I can say that I contacted them on that following Monday after he passed, so they have a contact number for me.
So you have left numbers there, and no one's reached out
Yes,
to you.
correct.
Where, at the Whitten Center?
At the Whitten Center, I called because we were trying to get his final arrangements and stuff set up, and so I contacted the HR department and spoke to and I can't remember names, but I spoke to the head of the HR department and another lady, and left a number. They were to return a call to follow up on his benefits.
So tell me, important question here. Do you think that your brother had the protection he needed to be safe at work during COVID?
I don't, because even if they gave the mask, this is it's new to everybody. So if they didn't know how to properly wear the mask, or and then you're working with individuals with developmental disabilities, making sure that they kept their mask on, and you're in close contact. You have to be in close contact because he was a direct support staff. So I don't really know the proper way they social distance, and then you have to have a guideline that if someone is exposed, or if someone tested positive, what are your guidelines of separating them from the regular population?
We can tell you that some of what we are reporting this evening in our special, or tomorrow evening in our special report on Tuesday night, is that the staffers in some instances were using these plastic raincoats that they would wear into the COVID patient room, but they were sharing them, and they would be responsible for spraying them down when they were done, so it would be ready for the next person. And they were sharing those between shifts. This is according to staff members. I don't work there. I can only count on. I've heard this story from multiple staff members, current and former staff members, and then that also the N95 masks, they were being asked to wear them over and over and over again, which is happening around the country. But we spoke to the infectious disease guy, who says really 5 days, would be about the maximum, and some of the masks have been around, for weeks. So they're told to keep them until they wear out or break or something. And they can get a new one when that happens, is what I have been told by staff. So, those are some things that I don't know if you as a family member are aware of, but I wanted to let you know about that.
We weren't. Oh, yeah, we weren't aware of that.
And what are your thoughts
I do
on
know
that?
I think it's horrible. I think if you're requiring someone to work, then you should have the proper equipment to keep them, at least try to your best ability to keep them safe. You can't, COVID it's so highly contagious that, even with gearing up and wearing the proper equipment, we know we see people that's in the healthcare that it still might not be 100%, but you got to do to the best of your ability to protect your staff and the consumers in this incident. And
Absolutely.
I don't see that they did that. And it's hard to believe that they really cared when they can't even reach out to a family to do a proper way of expressing their condolences.
Well,
So that speaks highly of what kind of conditions he may have been working in.
yes, ma'am. I appreciate you talking to us and representing Maurice in this terrible story. I'm sure he is looking down and so proud of you for being his spokesperson today. You know, because he
Yeah, he
can't
would have
speak for
done.
himself.
Yeah, he would have done the same for us. No doubt.
Well, Ella, thank you, and my
Hmm.
condolences to your family. Please send, on behalf of all of us, we're so sad and so sorry that he was lost. He is a healthcare hero, you know? I mean, they
Thank you.
talk about that, they say that, but Maurice is the guy.
Thank you.
So we do appreciate Ella speaking with us, and I apologize to any of you who are having broadcast interrupted difficulties. I did switch over to cell phone instead of Wi-Fi here, so I'm hoping that will take care of it. But again, my apologies. Technology is not perfect, and this feature of being able to roll the video to you guys is a new feature that we're trying to bring you tonight. So I appreciate you watching and bearing with us. I have another interview coming up with a mom whose son had COVID and has recovered. I do want to thank you guys for tuning in, and I do want to thank the people who have spoken up and reached out to us. They are kind of, a little nervous about doing that, and I know it's a risk you take, and I appreciate that people have done that. So I didn't get a chance to say that earlier, and I wanted to thank those who have. Also, I want to bring you this story. Okay, there's a great group. It's called the Whitten Center Friends. Hold on. And they have a Facebook page. And a lot of the feel for the way the administration has communicated has come from this page, because you can see, like, they've written some letters to the staff and family and such, and you can read through those on their Facebook page. You can also follow along. This is a very important facility to a lot of families, including Mary Mills, who you're about to meet. Her son, a 22-year-old, has been there for about 3 years, I believe she told me. And she's very pleased with the facility, and even despite the fact that her son got COVID and has made it through. But she's part of the Whitten Center Friends sort of group, which is kind of run by the Parents Club, which is very active at the facility in normal times, right? They can't go and visit right now, just like with nursing homes and assisted living. Mary wanted to kind of give her take on the experience she's had in COVID, and to show her appreciation to both the staff and the administration. Hey everybody, Amy Wood, joined by Mary Mills. She is a mom of one of the kids at Whitten, as you like to call them, right? There's all these words that are used: consumer, resident, but your son Robert has been there for a few years, and he wound up getting coronavirus, but he's had a really good outcome. So can you talk a little bit about what your experience has been like?
Well, starting in March, when the virus first appeared, Whitten Center made the decision that they needed to go into a lockdown, like nursing homes and stuff. So they told the parents, they discouraged us from visiting, and we said, okay. And from March, April, May, all the way to that last week of June, when I called and checked on Robert, he was fine, he was healthy, which, is a miracle. I'm talking about a child who doesn't understand social distancing, can't wear a
Sure.
mask, doesn't
Yeah.
wash his hands, puts anything in his mouth. And Whitten Center and our fabulous staff kept him well that whole time, and I credit them with that. And then one night in June, that last week of June, first week of July, I got a call from the head of his unit saying that Robert had, not been himself. A little bit, he moves constantly, and apparently had been a little bit low energy that day. that he had vomited once. They had immediately checked his temperature, and it was 100 degrees. And then, of course, he was going to be tested for COVID. And they did test him, and he came back positive for COVID. But Amy, after that one incident of 100 degrees and that one incident of vomiting, he was a little bit, low energy for a few days, but that was it. He's turned right around. He's doing fabulous. Robert, he never had cough. He never had trouble breathing. No high fever. Excellent. And I credit that with the incredible care he's been given by Whitten Center. I really do. I really do.
And one of the things you wanted to be able to say here today, I mean, one of the reasons you really pushed, like, hey, I really want to talk, you really believe in the staff. I mean, you really believe the folks that are there working, and everyone, like the administrators, you're very supportive of the facility and your experience there.
Amy, it has been wonderful. The numbers are scary. They are scary. And you look and you see we had this many staff test positive, and this many of our children test positive, and it's scary. And there are people who are very sick, and we have lost a staff member, and we have lost consumers, and that's 4 families that have been changed forever. And that's my nightmare, and my heart goes out to them. And it goes out to the parents right now who do have sick children in the hospital. But also in those numbers are children who are, from the parents I've talked to, some of them are asymptomatic. Some of them are mild cases like my Robert. So I think in the middle of this very difficult time, and in the tragedy, is we need to be aware that Whitten and our fabulous staff, our administration, DDSN is, from my view, as a parent, doing a wonderful job of keeping our children well, keeping our families informed, helping the sick children get the services they need, whether they need to go to the hospital or whether they can be cared for in the unit. They are just doing an incredible job, and it's a very hard job. It's a very hard job, and I want people to understand the numbers are scary, but there is some bright light in Whitten, and that's our staff and our administration.
Do you have any concern at all about the spread? Like, in other words, that it got that spread across the facility, and how that happened?
It's a pandemic, and I don't want to armchair quarterback something, because we're not through the pandemic. I think
Sure.
as a society, when all this is over, we as a society are going to have to look at our healthcare system and say, this worked, that didn't work. We worried about something here we didn't need to worry about. We caught this in time. But I think right now, in the middle of it, on the learning curve, I think everyone has done everything they can. I think the workers have done what they can to keep it out of the facility. I think the other staff has done that. And I'm talking about right now the housekeeping. I think everybody has been committed. It's ridiculous to assume it would never get into Whitten. This virus gets everywhere.
Mm-hmm.
And, we knew it was coming, but my gosh, for my son to go March, April, May, and not test positive for it, when this is a child who is medically compromised, who has a history of over 35 hospitalizations and pneumonia, for him to stay well that long, I think is wonderful. And for him to get such mild case and recover and be back to, I don't want to say normal, because their life is different right now. They're not able to go out in the community and stuff like that. They're still on lockdown. But I really think people have done a good job, and you can't, I don't want to fault anybody for it getting in there. Nobody intentionally took it in there,
Sure. Yeah, of course. Well, and we're raising the questions, that the staff has raised. I mean, that's who we've heard from, and they have concerns. But it's interesting to get a parent's perspective. I know also one of the things you really share with me that people would relate to, I'm sure, is how worried you guys have been. Like, I mean, you were worried if Robert, your son, I think you have a picture of Robert. We should show everybody Robert. But there's Robert.
That's
He's
all right.
22, right?
He's 22 now. That was taken when he finished high school. Children like Robert don't graduate; they get a certificate, but we're proud.
I don't blame you. But you were worried, Mary. I mean, you talked about how, I mean, your greatest fear was if he gets it, he won't make it. You know, because of all those vulnerabilities, right? But he's made it.
Amy, I'm going to be honest. My family and I, when the pandemic first broke out, um, we thought if this gets Robert, he ticks all the boxes of people who
Hmm.
aren't supposed to survive, and he has survived. And I have been very concerned about him, but I also want to say, not just worried about Robert, but I'm not there. I haven't seen my baby since February.
Yeah.
That's my child,
Hmm.
and he is nonverbal, so I can't talk to him on the telephone. So I have to rely on the staff and the administration. So I have worried about them, and I think one thing that we're hearing across this country is from our frontline workers, and they are asking questions and they have concerns. And it's not just specific to Whitten. There
Hmm.
are, we sat here and we watched it happen in New York. The
Yeah.
the trouble with the PPE, the long hours, I signed up to be here and now my job involves this. It is a nationwide issue that I hope when we come out of, we are going to step up and give a little bit more care to our workers, better compensation, listen to their ideas and input. But it's not specific to Whitten. This is going on everywhere. And every single healthcare worker in this country who is on the front line right now is raising the same issues. And I think that says something about our country, Amy. I really do.
Mary Mills, we appreciate you joining us and giving your perspective on this. Thank you so much.
Thank you, Amy. And I would say anybody who wants to support Whitten Center,